So we're going to do active range of motion of the C-spine with overpressure. So can I just get you to bring your head into flexion, so bring your chin to your chest, and I'm just going to apply a little bit of overpressure. Any pain or discomfort?
No.
Okay, and relax. And then just bring it back as far as you can. Any pain or discomfort?
No.
Okay, relax. And then just bring your right ear to your right shoulder and lateral flexion. Any pain or discomfort?
No.
And how about now?
No.
Okay. Relax. And for the other side, so your left into lateral flexion. Any pain or discomfort?
No.
And what about now?
No.
Okay. Now can you rotate? So just look to your right. Any pain or discomfort?
No.
And overpressure. Any pain or discomfort?
No.
Okay, and we'll do the same for the other side. So look left as far as you can. Any pain or discomfort?
No.
Okay, I'm going to do passive range of motion of the shoulders with end feels. So I'm just going to bring your shoulder up, and don't help me at all. Do you feel any pain or discomfort?
No.
And I feel a capsular end feel. And then I'm just going to bring it back. Any pain or discomfort?
Nope.
And I am feeling a capsular end feel as well. And then I'm going to bring it up. Now I'm going to bring it to abduction. Any pain or discomfort?
No.
And I feel a capsular end feel. Now I'm going to bring it into adduction. And do you feel any pain or discomfort?
Nope.
And I can feel a capsular end feel. I'm going to do shoulder external rotation. And do you feel any pain or discomfort?
No.
And I can feel a capsular end feel. And then I'm going to do internal rotation. Any pain or discomfort?
No.
And I can feel a capsular end feel as well. So all of the ranges of motion of the shoulder should be a capsular end feel. And if it is anything other than that, like soft tissue approximation or a springy block or empty, then that would be abnormal. Okay, so I'm going to do resisted range of motion of the hip joint. So can I just get you to lie on your back in supine? So first I'm going to do flexion. So if I could just get you to bend this knee and put your foot flat. Good. And then I'm going to stabilize your hip. And then I'm going to just bring you into half range of flexion. And then you're going to resist my movement, so don't let me move you. And on a scale of 1 to 5, I would rate that as a 5. Now I'm going to bring you into abduction. So, you can do that. So I'm just going to bring you half range out. And then don't let me move you. And I would also grade that a 5. So I'm going to do hip abduction. So I'm just going to bring you, so I'll just bring you to half range. And if you could just resist my movement, don't let me move you. And I would grade that a 5. So for hip abduction, can I just get you to bend this knee and move it off to the side? And then I'll bring your leg into half range again. And don't let me move you. And I would rate that a 5. Now, can I get you to flip onto your stomach in prone position? So first I'm going to bring it into half range of extension. And then don't let me move you. Any pain or discomfort?
No.
So I would rate that a 5. And then I'm just going to bring your leg up. And for external rotation, I'll just bring you to half range, and then don't let me move you. Any pain or discomfort?
No.
And I would rate that a 5 again. And for internal rotation, bring it to half range. Don't let me move you. And I would rate that a 5. So I'm going to do the anterior-posterior drawer test to assess the anterior cruciate ligament of the knee. So I'm going to have you on your back in a supine position. And then I'm going to place the affected knee in this position. So with the hip slightly flexed and the knee flexed. And then I'm going to stabilize the foot by placing my thigh on my client's foot. And then I'm going to place both my hands on the tibia and place my thumbs just above the tibial plateau. And then I'm going to pull the tibia forward. And do you feel any pain at all?
No.
Any discomfort?
No.
So if my client did feel pain or I felt the tibia move more than 6 millimeters, the test would be positive. So I'm going to do a Thomas test for the iliopsoas muscles to see if they are short or tight at all. So I'm just going to have my client sit on the edge of the table. Good. And so I'm going to ask my client to grab their knee and bring their leg into flexion, and that will be the unaffected side. So now I'm just going to ask my client to lean back slowly. And then if this leg came off or came up at all, then the test would be positive. So I'm going to do Thessley's test, and this is to test for a meniscal tear in the medial or lateral meniscus of the knee. So if I can just get my client to stand on one leg, and then I'm going to hold her hands, and I'm going to come around this way. Are you feeling any pain or discomfort?
No.
And again to this way. Any pain or discomfort?
No.
So if she felt any pain, then the test would be positive for medial or lateral meniscal tear. So now I'll be doing the neurological testing for C5. First I'll do the reflex testing. So can I just get you to relax your arm? Mm-hmm. And I'm just going to tap the bicep tendon, and the bicep should contract. So that is a negative test. If it is positive, then the bicep wouldn't have contracted. So for the dermatome testing of C5, I'm going to start at the trap ridge and just travel down the arm to the thenar eminence and just ask my client if she could feel that. So can you feel when I go all the way down? So that is negative. If it was positive, then she wouldn't have felt it all the way down. So for my myotome testing of C5, I'm just going to get my client to abduct their shoulder, so just bring your shoulder out, and then laterally rotate. So rotate them, yep. And do you feel any pain, numbness, or tingling?
No.
Okay, you can relax. So if it was positive, then they would have, their symptoms would be recreated. So now I'm doing the neurological testing for L4. So for the reflex, I would just tap the patellar ligament or patellar tendon, and the quadricep muscle should contract. So that test was negative, and if it was positive, then the muscle wouldn't have contracted, and there would be a nerve root pathology of L4. For the dermatome testing of L4, I would start touching at the big toe and then just come across to the lateral aspect of the knee. And I would ask my client if they were able to feel all that. Is there any point where you could not feel me touching?
No.
So that's a negative. If it was positive, then there would be a point where she couldn't feel my touch. For the myotome reflex of L4, I would just support my client's leg, and I would get them to dorsiflex their ankles, so just bring your toes up, yep. And do you feel any pain, numbness, or tingling?
No.
Okay, you can relax. So that was a negative test, but if it was positive, then they would have felt a recreation of their symptoms.